Thank you so much for inviting me today. I feel very privileged to speak on the body art industry, since it's been my entire world, 24 hours a day, for almost half a century now. I'm amazed at how far we've all come over the years, not only with the technological advances that improve the quality of the procedures we produce and all the amazing gifted artists who have become the most talented generation I've seen, but most importantly, the level of safety practices that all of us now regard as second nature. I believe the standards for protecting the public health and ourselves set by the states and local health departments have raised our industry's awareness and acceptance by the public to a status never imagined just 20 years ago. So let me begin by giving you a brief history of how I became involved with agencies such as AFDO, NEHA, and CEHA in developing recommended bloodborne pathogen standards. For me, it all started about 22 years ago when Kathy Hartman from the local health department came in to inspect my shop, Absolute Tattoo, Piercing, and Permanent Cosmetics. We became good friends and began working together on reviewing and updating the existing San Diego County body art regulations. We turned to OSHA to become more informed about bloodborne standards and what was expected from us. We ended up taking so many bloodborne pathogen and general industry classes that naturally the next step was to become OSHA authorized outreach trainers. Eventually, we realized that the body art industry could benefit from industry-specific bloodborne pathogen training. In the beginning, this type of training was not required. However, we quickly realized that everyone was occupationally exposed to bloodborne pathogens and other potentially infectious materials, OPIMs. Bloodborne pathogen training classes for body artists did not exist. So we decided to develop a bloodborne pathogen training class that was industry specific. After researching various existing body art regulations across the country, we discovered that regulations between federal, state, and counties were very inconsistent. One county might base their regulations on OSHA standards, another from the food division at the local health department, and some based on industry input. It was really kind of a nightmare. So, naturally, when California was developing their own body art bloodborne pathogen standards in 2012, we both jumped at the opportunity to work on the steering committee with Assemblywoman Ma and industry experts like Steve Joyner to provide input and create California's Safe Body Art Act, AB 300. From there, other organizations that regulate and represent our industry began to invite us. It has become my passion to see our industry become the model for how body art businesses operate. Now, this is why you're all here, so let's jump into the topic of the day. Overview of basic health and safety regulations and the body art industry. After my immersion into the life of health regulators, the everyday working of body art businesses, and as an educator, I have come to rely on three ideas that are the foundation for everything I do in this business. From Kathy Hartman, when you protect yourselves, you protect others. Of course, she might have gotten this one from one of you. 2, that the body art industry should be governed by evidence-based rules. And 3, from FDA, say what you do what you say, and prove it. I would love for every body art facility to adopt this as their operating creed. I'm sure there are a few people attending today that remember the days when the body art industry was left to their own devices, especially in regards to worker health and public safety. It was basically non-existent. Gloves? Really? Disinfectant? Like Listerine, right? Barriers? Like the Great Barrier Reef? Documentation? I've got my paperwork here somewhere. Today, our body artists and health inspectors are informed and sophisticated partners that protect themselves and the public from blood-borne pathogens and cross-contamination. This didn't happen overnight. It took years of working out the industry's best body art work practices, regulatory oversights, hours of education and guidance. So you want to open up a studio, a shop, salon, a parlor, or whatever you want to call it, but you just want to do a tattoo or apply some permanent cosmetics or maybe just a piercing. So where do you start? Thankfully, most states now have similar and encompassing body art regulations, and all the information you need is just one click away on the internet. Public health agencies like the CDC, FDA, EPA, NIOSH, and OSHA have a hand in researching, recommending, and regulating the various blood-borne pathogen standards. We rely heavily on body art standards that are guided by federal, state, and our local health agencies. In the body art industry, the requirements of health-related regulations are a relatively new concept. So where do these regulation standards of practice come from? Center for Disease Control, CDC, as the nation's health protection agency, they inform and protect people from health, safety, and security threats. CDC provides information and guidance about blood-borne pathogens that comes from NIOSH. The National Institute of Occupational Safety and Health, NIOSH, is our national research facility and is part of the CDC and OSHA. We rely on them to research areas of occupational health and safety and to adapt standards into practice. NIOSH set the safe distance between the sharps container and the practitioner for the workstation area that we adhere to today. Environmental Protection Agency, EPA, is an independent federal agency which was created in 1970 to establish and enforces rules and standards that protect the environment and control pollution. In the body art facility, every chemical used for whether cleaning, disinfecting, or body art procedures is required to have a safety data sheet filed in the facility. The Food and Drug Administration, FDA, is responsible for the safety of our food, drugs, and consumer goods. They review the tattoo inks used in our procedures. It gets complicated, though, because their role in assessing inks used in permanent makeup and tattooing are subject to approval as cosmetics. The FDA traditionally has not exercised any regulatory authority for color additives, another word for cosmetics, which means they do not approve or disapprove inks unless there is a consumer complaint. That being said, artists should only purchase from trustworthy manufacturers and distributors. They need to be aware when the FDA requests a recall from the manufacturer. Occasionally, representatives from the FDA will participate in our AFTA or NEHA body art committee meetings. The Occupational Safety and Health Administration, OSHA, play a major role in ensuring workers and public have a safe and healthful environment for practicing body art. In addition, they establish standards, enforcement, provide training, outreach education, and support. Everyone in the body art industry, including owners, employers, must comply with all OSHA blood-borne pathogen standards. I have been an OSHA authorized industry-specific outreach trainer since 2003. The National Environmental Health Association, NEHA, is a private nonprofit organization that works to credential public health officials who have reached their high standards to build, sustain, and empower an effective environmental health workforce. It is as relevant today as it was when the organization was founded. I continue to work with NEHA's Body Art Committee. Currently, we are developing the Body Art Model Codes Annex. The Annex will provide more in-depth information on specific topics and will give resources for researching your area of interest, such as how to develop a standard operating procedure, SOP, for things like sterilization, setup, teardown, or hazardous waste. Requirements for creating an exposure control and an infection prevention plan, ESOP. Association of Food and Drug Officials, AFDO. This international nonprofit organization whose goals are to streamline and simplify regulations by either drafting regulatory rules or by commenting on government proposals. AFDO strives to protect public health and safety by working collaboratively with public and private sectors, advocating with a united voice to make a positive impact on food and medical products, safety laws, rules, and regulation. As a member of the AFDO Body Art Committee and the Body Art Educational Alliance, the BAEA, we are creating a web-based PowerPoint presentation of the Body Art Model Code, BAMC, for anybody to reference as an additional educational resource. What is the importance of having an ESOP? It's our job to take the 3 R's, no, not reading, writing, and arithmetic, but rather requirements, regulations, and recommendations. With this information, we are tasked to establish work practices, standard operating procedures, training plans, and documenting everything. In the written ESOP, we need to cover all aspects of our business, the processes, procedures, and physical conditions where the risk for an exposure within the facility may exist. This requirement means that all body art facilities must have an ESOP on site. This manual is the facility's guide for defense against blood-borne pathogens. There seems to be confusion between the ESOP and the Infection Protection Control Plan, IPCP. I think of the ESOP as OSHA's manual that promotes a safe working environment for employer and employee, where the IPCP is the document that supports a safe environment for the public. However, our goal should be to protect everyone who enters the facility. Talk about a huge, mind-boggling project. Establishing an ESOP is the first step when setting up or updating a body art facility. An owner's primary duty is to provide a safe work environment, which also creates a safe public environment. So, how does an owner go about putting this book together? There are businesses who can help, as well as federal agencies, state, and your local DEH, providing online templates to assist you with this monumental task. Owners must review and analyze all processes, procedures, and physical conditions that could potentially pose a risk of an exposure. Then write the step-by-step instructions, which becomes their standard operating procedures, SOPs, to prevent possible exposures in their facility. During this process, you should engage your staff for their input. They are the ones that have to follow these procedures and have the greatest potential to be exposed. The ESOP manual becomes a living document and should be updated whenever new requirements, techniques, or just updating current procedures and processes. As a consultant, I help facility owners put together their own ESOPs. I guide them through the process by questioning how everything is run in their facility and to help them to make sure they are in compliance with their local jurisdiction. I have developed a framework for writing an ESOP by asking blood-borne pathogen-related questions, ensuring exposure control activities are in place, and how to work safely. The first step is to determine where and how the risk of exposure might occur. When I walk through the front door of my shop, either by habit or because of years of experience, I'm always looking around for the potential risks to exposure. I don't think I'll ever stop. OSHA defines occupational exposure as a reasonably anticipated skin, eye, mucous membrane, or parenteral contact with blood or OPIM that may result from the performance of the worker's duties. Parenteral contact is defined as piercing of the mucous membrane or the skin barrier through such events as needle stick, cuts, human bites, or abrasions. Due to the nature of the body art industry, all workers are subject to the same risk to occupational exposure, hazards to blood or OPIM, and should follow their procedures and processes as outlined in the facility's ESUP per OSHA. To provide a safe environment, owners and staff evaluate everything that happens within the facility, the cleaning processes, how supplies are stored, sharps containers. All these things are part of evaluating exposure risk. This process is called exposure determination. After this review, the owner will ensure that standard precautions are in place for everyone's protection. To ensure the facility is compliant with local health department regulations, you need to have an ESUP IPCP in place with a written SOP for everything done in the facility. Artists have to have up-to-date annual industry-specific BBP certificates of completion, proof of the hepatitis B vaccine or a declination on file, engineering controls in place, proper signage, SDS for all the chemicals, and a hand washing station with hot and cold water that is accessible to all of the procedure areas, soap dispenser, and single-use paper towel. These are a few examples of compliance. Education and training are critical. We as educators and our regulators rely on our own education, training, and experiences to educate facility owners in becoming knowledgeable in the area of bloodborne pathogens. In addition, facility owners are now responsible for the initial and updated training for all staff on facility work practices and SOPs in the ESUP. In my structured training courses, the ultimate goal is to provide everyone with a clear understanding of the risk, how to avoid them, by giving them the knowledge and skill needed to do their work safely, how to identify hazards, controls, and how to report them. Health and safety programs should become second nature, and ideally, training courses encourage better understanding of the risks and how to better prepare to deal with them. Every year, all staff must complete an annual approved industry-specific bloodborne pathogen class and receive a certificate of completion. All bloodborne pathogen classes have the same basic information as required by OSHA. However, Los Angeles County and the state of Florida have additional specific requirements for their bloodborne pathogen classes. This is an area where we need to work together in creating a universal class no matter where we work. The BBP certificate must be available to regulators upon request. Training could be something like in-house SOPs, worksite demonstrations, which are excellent techniques for conveying safety concepts, ensuring and understanding the potential hazards, and by promoting good work practices. You can also find body art classes online or from other sources like industry groups as Kathy Hartman's Body Art Training Group, or the Association of Professional Piercers, APP, or the Society of Permanent Cosmetic Professionals, SPCP. Training documents should contain the subject covered, trainer's name, trainee's name, and the training date. These documents should be available for inspection. Training all staff on the proper use of PPE is important so they can protect themselves, clients, and family. Again, when we protect ourselves, we are protecting others. Commonly used personal protective equipment, PPE, is gloves, sleeve barriers, eye protection, aprons, and mask. The most common transmission mode of pathogens is by failing to properly wash your hands. In the midst of the COVID-19 pandemic, this has never been more important. Facilities must have hand washing stations that are accessible to the procedure area and should not be used by the public. When washing your hands, be sure to remove all jewelry. Use warm water and don't forget the soap. It's important to note that alcohol-based hand rubs are not a replacement for hand hygiene. The efficacy of gloves in preventing contamination of hands and helping to reduce transmissions of pathogens in healthcare has been confirmed in several clinical studies. This is my grandson getting ready to tattoo my name on my husband. A glove SOP procedure should include a few things like keep fingernails trimmed, neat and smooth to avoid puncturing or possible tearing. If you use latex gloves with petroleum-based products, beware of the breakdown time. Ensure you always choose the correct glove for the task, like latex or nitrile. What are sharps? Sharps are one of the most dangerous things we come across in the body art industry. Sharps are tools like tattoo needles, piercing needles, razor blades, and even a toothpick. Any one of these can become contaminated during a procedure, and if not handled properly, they can put the artist as well as the client at risk of an exposure to other potentially infectious materials, OPIMs. Guidelines for sharps containers are regulated by OSHA. 29 CFR 1910.1030, Section A41. Always put used sharps in the sharps containers immediately after use. Never lay a sharp down on any surface. This is a recipe for a needle stick. Sharps containers are considered full when the container is 3/4 full. Disposing of sharps containers are regulated by your local health department. Hazardous waste is governed by federal agencies such as FDA, OSHA, CDC. Individual states and Department of Environmental Health, DEH, have their own statutes regulating the sharps container disposal under biomedical hazardous waste haulers, or some form of those words. Body art facilities can choose pickup or mail away. However, either method needs to be documented and the record available for inspectors. Improper management of sharps containers pose a serious threat to human health and the environment. When we are performing a procedure, we need to think about how this affects the circle of sterilization. The process starts in the sterilization room, whether in-house or using only purchased single-use disposable supplies. The process ends by documenting the sterile supplies used for the procedure onto the client's informed consent and release forms. I'll talk about informed consent a bit later. We train our staff according to our standard operating procedures, with a consistent method for buying and protecting our sterile supplies. They can be purchased as sterile, disposable, prepackaged, single-use supplies and instruments, things such as needles, blades, tubes, setup kits, and so on. Today, disposable supplies are high quality and inexpensive, making them very attractive for artists. If it's not already provided, you need the test of sterility document from that manufacturer. This explains how the disposable, sterile, single-use supplies were sterilized. Whether purchased or sterilized in-house, we need to document the date of purchase, the company purchased from, a description of supplies purchased, the expiration date and/or lot number of the package. And don't forget, always wear gloves when handling sterile packages. Completing the circle of sterilization by documenting the client's informed consent and release form, with a sterile indicator lot number and/or expiration date of any sterile instrument that was used on the client for the procedure, like instruments, jewelry, and pigments. We list the manufacturer's name, the lot number, and the expiration date of the sterile pack. Sterilizing your own supplies is a serious responsibility and should not be taken lightly. These basics are essential to effective sterilization: ultrasonic design, autoclave design, monitoring and documenting every load on the sterilization log. Most agencies provide a sample sterilization log. The sterilization log records or documents pertinent information and includes the Class 5 integrator, which indicates a complete sterile cycle. This log is kept as long as required by your local DEH. Don't forget to document routine spore testing and equipment maintenance. While wearing all of your PPE for cleaning, disinfecting, sterilizing instruments, and jewelry processing in a well-stocked sterilization room that is separate from the procedure area and identified with an appropriate signage, organized to prevent cross-contamination, and shall flow from dirty to clean and deep plumb sink with hot and cold running water. Biological spore testing of autoclaves is the most acceptable means of monitoring sterilization because they assess the sterilization process directly by killing known highly resistant microorganisms. Autoclaves shall be tested at least once a month. This ensures the process is working correctly. After the sterilization cycle has completed, the spore test strip is mailed to a third-party spore testing facility, along with their required forms. Document the spore test results on the sterilization log and file in the ESEP. The logs and the spore testing results shall be kept for a minimum of 3 years. The informed consent and release form is an agreement between the practitioner and the client. The client needs to be aware of several things regarding the procedure. It educates the client about expectations and gathers information that may impact the outcome of the procedure. Due to the permanency of the procedures, reviewing the informed consent and release form for accuracy is a must for the artist and the client. Every state has age limitations for various body art procedures. This is the time to verify their ID. In the event you discover a client has an adverse reaction to a tattoo, piercing, or permanent cosmetic procedure, whether from the products used or the procedure itself, the artist should contact the manufacturer to find out if there has been a problem with a lot or recall. Then inform the facility owner, contact your local health department, and MedWatch at fda.gov. Fill out an adverse reaction form which documents the entire procedure. For aftercare, clients must be given verbal and written instructions to ensure they understand what to expect during the healing process. Basically, the do's and don'ts. Since we are not medical professionals, we can only suggest how to care for a procedure. California State AB 300 requires this specific information. Signs and symptoms of infection are, including but not limited to, redness, swelling, tenderness of the procedure site, red streaks from the site towards the heart, elevated body temperature, and purulent drainage from the procedure site. Station setup begins with disinfecting the workstation. The next step is placing barriers on anything that could be touched or subject to exposure. It's important to have SOPs for every action involving the possibility of cross-contamination. Station setup is no exception. This should be routine and consistent so no steps are missed which could present an exposure. Like any job, different procedures require different equipment. Some of the equipment we use are needles, forceps, hemostats, closers, castings, couplings, tweezers, tubes, machines. Other disposable items we use for our equipment might be grommets, ink caps, and rubber bands. Equipment that contacts the skin must be either single-use or, if reusable, must be washed, disinfected, and sterilized prior to the next procedure. In the United States, inks used in permanent cosmetics and tattooing are subject to approval as cosmetics by the FDA. The pigments used in the inks are considered color additives, which are subject to pre-market approval under the Federal Food, Drug, and Cosmetic Act. Only commercially manufactured inks and pigments should be dispensed into single-use receptacles like an ink cap to prevent cross-contamination. Any ink in the cap shall be discarded immediately after the procedure is completed. Protecting the client from cross-contamination is rule number 1 before beginning any procedure. This starts in the lobby when the artist reviews the informed consent and release form with the client to discuss any concerns. Be sure to always wear gloves whenever touching the client's skin. Your station should be prepared with barriers and everything needed for the procedure. Being prepared reinforces client confidence. They can see that every aspect of the procedure has been carefully planned out and explained before starting. Most people have no idea what the difference between antiseptics and disinfectants are. Antiseptics are a disinfectant for the skin, living organisms, while disinfectants are for non-living surfaces like countertops, so you can see why these terms are commonly confused. After the procedure is completed and all of the social media pictures are taken, appropriately cover the client's procedure site with a dressing. Then the artist needs to tear down their station by discarding everything used for the procedure. Fold the work surface barrier with everything over into itself and place into trash as one entity. Then disinfect the workstation as described in your SOP. By now you would think general cleaning and maintenance is a skill every adult has. However, a written procedure is necessary to ensure it is done on a schedule and the same way every time. A clean facility promotes a commitment to a healthy and safe environment, free of physical and biohazards. A basic guide to cleaning is high to low, outside to inside, and clean to dirty, and be sure to document it. Our commitment to body art regulations leads up to this moment. What do we do if an exposure actually happens? Staff training is to recognize an exposure incident and to have a plan to remedy the situation, and a plan for medical intervention if required. SOPs in place for the immediate containment or remedy for common types of exposures. In the body art industry, the most likely exposure is a puncture from a possible contaminated sharp, such as a tattoo needle, piercing needle, toothpick, or a razor blade. If an exposure is caused by another person's body fluids, referred to as the source, a detailed SOP is in place to ensure proper medical treatment is addressed and documented. An emergency SOP, which deals with the aftermath of the contamination incident or an exposure, is crucial to everyone's health. The SOP details all aspects of the exposure, like where to go for medical treatment, how to get there, forms that might be needed, and what to expect after. Evaluating the circumstances, make recommendations for corrections, and document the entire incident is critical. All the records involved in addressing the exposure incident are confidential and governed by HIPAA and must be saved for 30 years. OSHA, first responders, and some regulatory agencies require safety data sheets, SDS, for every chemical used in the facility. From cleaning to procedures, we need to know exactly what we are using and the risks associated with them. In addition, mil-spec sheets for the metals used in the jewelries are required. The retention and confidentiality of documents are quite long. However, here are a few examples: facility license, local permits, insurance, sterilization logs, spore test logs, training records, consent and release forms, and medical records a client may have provided us with. As you can see in this presentation, we talked about a lot of topics and just touched on the basics. We could easily spend an hour or more on each slide. I love my industry, and I am always available to anyone who wants to discuss or learn more about the body art industry. For me, my life's passion has been to be involved in the body art industry. Being able to establish my own shop for 27 years now, and then grow my business to the educational side by providing our industry with specific bloodborne pathogen classes, general body art education, developing an industry-accepted ESEP, staying up to date and compliant has broadened my knowledge in both the area of body art and how it's regulated. Today has been quite an honor to give this presentation to the regulatory side of the business and attending artists, so everyone has a better understanding of how the body art industry operates and interacts with the regulatory agencies. Life would have been so much easier if I had all the today's resources available to me in the beginning of my career instead of the years of trial and error. I would like to thank you so much for having me here, and to Laurel and Amy at AFTO, my meticulous editor Nancy Crow for always being there to help with researching regulations, all aspects of our ESEP program, and the other documents related to our business, and Roxanne Hinkle, who has been by my side for 25 years now as my mini-me. The time has come to pass the torch to her, as she will be operating Absolute Tattoo, Piercing, Permanent Cosmetics, and allowing me to become more involved in the regulatory aspect of our industry. And last but not least, my amazing husband Bill, who has given my website its current modern look, re-recorded all my class videos, which I encourage all of you to take, organized my ESEP to a level I never imagined, and prepared this presentation for us today. In closing, we will leave this resource page up for you to take down some of my colleagues' information to check out. So does anybody have any questions?